A proposal to impose work requirements on Medicaid recipients could force thousands of Oklahomans to lose their health insurance. While the proposed guidelines would exempt pregnant women, new mothers, and children, critics say the rules unfairly target the poor who can ill afford to lose health coverage.
When the Trump administration allowed states more flexibility in determining eligibility for Medicaid, Oklahoma lawmakers jumped at the opportunity. The legislature quickly passed a bill to impose work requirements for Medicaid recipients, which was signed into law by then-Governor Mary Fallin, who also directed the Oklahoma Health Care Authority to seek a waiver from the Centers for Medicare and Medicaid Services to customize the state's Medicaid program. Under the proposal, able-bodied adults between the ages of 19 and 50 would be required to work or volunteer a minimum of 20 hours per week to receive Medicaid benefits, although parents with children under the age of 6 would be exempt. House Minority Leader Emily Virgin calls the requirement misguided.
So it's just feeding into a stereotype that people who are taking advantage of Medicaid are not working, that they're lazy. We have to get away from that because these people are our neighbors. They're doing their best, and a lot of times they are caring for other people in their family.
Carly Putnam, policy analyst for the Oklahoma Policy Institute, believes the proposal would take a bad situation and make it worse.
We know that most people on Medicaid who can work do work. Those who aren't working have pretty solid reasons for not working, whether it's an illness, a disability, they're taking care of a child or an aging parent.
Oklahoma Homeless Alliance Executive Director Dan Strawn says the proposal could have unintended consequences, including increasing the state's homeless population after people lose their health insurance.
We see folks here at the Homeless Alliance all the time that have an eviction notice or are homeless, largely due to an uninsured medical expense that they couldn't pay.
An analysis by the Center for Children and Families at Georgetown University estimates the proposal would mean that approximately 4,000 to 13,000 parents could lose coverage, and that number would grow over time. And notes that Oklahoma would be the first state to impose work requirements without expanding Medicaid under the Affordable Care Act. CCF Executive Director Joan Alker says the proposal would be hardest on the state's most vulnerable residents.
Really, this proposal is targeted at very, very poor mothers, and it would predominantly affect families in rural areas and small towns.
The report goes on to say it's in those small towns and rural communities where parents are more likely to receive Medicaid and where jobs are harder to find.
There are not any additional supports to provide them with job training or transportation or childcare that they need, nor does it assure there will be any new jobs, particularly in rural communities.
And even if recipients are able to work 20 hours per week, it would likely mean they would earn too much to qualify for Medicaid, leaving them uninsured.
Even if these folks get jobs, they probably won't get affordable health insurance. And that's certainly the case in Oklahoma. Our report found that just 19% of workers below poverty in Oklahoma were able to get affordable health coverage through their jobs.
Women currently make up about 80% of parents or caretakers in Oklahoma who rely on Medicaid for health insurance. And Alker says those are the ones who would likely suffer the most from the work requirements.
What it does mean is that we know, based on other state experience, that many of these very poor women will lose their health coverage through Medicaid. Unfortunately, that's going to make them less likely to be able to work, not more.
While several states have applied for waivers, Arkansas is the only state so far to impose work requirements, and the results have not been encouraging.
There have been thousands of folks losing their coverage in Arkansas. And in fact, some, we've heard reports, actually lost their jobs because they were unable to keep getting their medications that help them to control chronic conditions and help them to be able to work.
Adrian McGonigal is one of them. McGonigal, who suffers from severe COPD, a lung disease which causes shortness of breath, was let go from his job after missing work because he could no longer afford his medications as a result of losing his benefits. In a report for PBS NewsHour, McGonigal told correspondent Catherine Trammell that not only is he out of work, but his health may have been permanently affected.
The doctors told me each time that I have this like COPD flare-ups, it gets a little bit worse each time. So, I mean, that the damage there is already done.
The children of people who lose coverage could also be impacted. Oklahoma currently has one of the highest rates of uninsured children at 8.1%, and Alker says the proposal could make that situation worse.
We know from a lot of research that when parents lose coverage, their children may lose coverage as well. And it makes it harder for them to be a good parent. So this will be a setback not only for parents, but for their kids as well.
The public comment period on the state's proposal was scheduled to end January 18th. After that, it will be up to the federal government to decide whether the work requirements will be adopted in Oklahoma.